Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne and host of the Winter Wellness series of the Kids Health Info podcast. Today, we're talking about RSV, and back joining me for some great advice and information as always is Dr Margie Danchin, paediatrician and immunisation expert. Welcome, Margie.
Thanks, Anthea.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
Today, I want to talk about RSV. So this is a respiratory virus, and for a lot of people out there, it feels like it might be new or different from the common cold viruses that we know a lot about. Can you tell us a bit more about that?
So the RSV, or respiratory syncytial virus, is definitely not a new virus. I've been a paediatrician for 25 years. We've been seeing children with RSV illnesses forever. Certainly the wards, get clogged up with little babies being admitted with RSV infection. So this is like the common cold virus. It can start off with a runny nose, sneezing, coughing, but this virus actually then goes into the lower airways and causes wheezing. And in very little babies, it can actually cause pauses in breathing and what we call apnea, which can be a bit scary as well. But it causes bronchiolitis, which is a bit like asthma, but in very young infants with the wheeze, and also pneumonia.
Is RSV going to cause a serious illness in all children?
There are definitely children who are more at risk from severe RSV infection. So children who are most likely to need to be admitted into hospital and stay in hospital to be cared for are children under 6 months, and particularly babies under 2 months. And of course, those children with chronic medical conditions of the heart or lungs or other certain conditions. But up to the age of 2, children can also get sick, particularly if they have some of those chronic risk factors, but also adults again over the age of 65. But for most children, RSV is going to look like that common cold virus with runny nose, congestion, a bit of a cough. They'll be miserable, but it won't make them seriously unwell.
Tell us about how those younger children that are most likely to get serious illness or most at risk can be protected from RSV.
Well, the RSV program that's been introduced in Australia this year is super exciting. It's an absolute game changer. So we have 2 ways that we can protect children, and that's by what we call passive immunisation, where we actually give the baby antibodies to fight the RSV virus. We can do that by 2 ways. The first is by giving the mum a maternal vaccine against RSV. The mum makes the antibodies, and then those antibodies pass across the placenta to the baby and protect the infant in the first 5 to 6 months of life. Or we can give the baby what's called a long-acting monoclonal antibody, which is again another form of passive immunisation, where we give the baby an injection in the muscle in the leg and we give those antibodies straight to the baby. And it's called long-acting because, again, it protects the baby for about 6 months. Now, they're very similar in effectiveness. In terms of prevention against hospitalisation, it's somewhere around 70 to 80% for both of them. And in Australia, we've now obviously got this new vaccine program for pregnant women that was announced on the 3rd of February, which is so exciting. And each state in Australia now has a program also to be able to give infants whose mums didn't get a vaccine in pregnancy that antibody into the leg at delivery.
This vaccine sounds really exciting, but it's not actually available to all children. Who's eligible?
So the passive immunisation that's given directly to the baby is available to all infants, again, whose mums haven't had the maternal vaccine, under 8 months of age, so for the first 8 months. And then children who are at higher risk of getting very sick from RSV, so these are kids with underlying congenital cardiac disease, chronic lung conditions, ex-premature babies, low birth weight infants, Indigenous infants, they can actually get access to this medication in the second year of life as well.
What about for older kids who are not eligible for the vaccine?
Yeah, for older children, unfortunately, the science has been really tricky to develop a vaccine against RSV for older kids, for children 6 months and older. It's still very much a watch this space, unfortunately. We don't have vaccines yet for older children. We do have vaccines that are now available and are coming on to the National Immunisation Program for adults over the age of 65, which is really exciting. But unfortunately, again, we need to come back to those common hygiene practices to protect older infants and children in terms of hand washing and just, sneezing into their elbow, being aware, sometimes, in fact, even wearing masks in crowded places or on a plane is okay as well if that's what you want to do to protect yourself or your children from respiratory infections.
And I think it's important for parents to have an understanding of the likelihood of serious illness from RSV in an older child who's otherwise well with no underlying health conditions.
It would be quite uncommon for an older child to be admitted to hospital with RSV unless that RSV, for example, triggered an asthma attack. Yes, they could have pneumonia. It's much higher. It's a much higher risk in younger children, so under the age of 5. As I said, it is unfortunately the leading cause of pneumonia in the world, and we do see a great impact in younger children. So we do need to be aware who's at highest risk. If a new baby is under 8 months, they can definitely access the passive immunisation injection themselves. If their mum didn't get the vaccine in pregnancy, those higher risk kids in the second year of life, they absolutely should go and get another dose. Otherwise, we really need to focus just on good hygiene for kids.
Excellent. Thanks so much, Margie. So people who can access the immunisation for their baby, get on and do that. And then a reminder, always hand hygiene, staying home if you're sick, all those cough protection measures to help keep everyone else well and hopefully steer clear of RSV this winter.
Absolutely.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.